Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. I'm in Burrowang, New South Wales in Australia. As you know, it is just gone 10 o'clock Friday morning. It gives me great pleasure today to welcome to the studio, all the way across the other side of the world in Berwick, Pennsylvania, which is 2 to 3 hours north of Philadelphia. I've got Allyssa Mizenko, and Allyssa and I have been chatting for about half an hour now, and we spoke for about, I think, 3/4 of an hour about a month ago. Allyssa is a dental practice coach and trainer, but she hit my radar because of an article that I read that she wrote on silos, believe it or not, in dentistry, and how they are not a good way to run a business. And a lot of businesses outside of dentistry will tell you that too, that you can have silos, but they have to integrate. And I thought this was a great concept to bring from other businesses into dentistry as a lesson that we need to not operate in silos. But I'm going to pass it over to Allyssa to explain this, because I don't want to explain it for her, because what's the point of having her here if I'm going to tell the story? Allyssa, welcome to the Ultimate Dental Podcast studio. So great to have you.
Thank you so much for having me. I'm so glad to be here.
That's good.
So
Now,
the silos, I've been in dentistry for about 13 years at this point, and it has always baffled me how we either in the field are either seeing everybody wearing all of the hats and doing all of the work, or we're living in silos where the front desk knows what they're doing, the clinical team, dental assistants know what they're doing, and the hygienists know what they're doing. But there's very little overlap sometimes, and there's not a lot of communication amongst the team from the administrative side to the clinical side. And when we live in silos, when we live in a space that is siloed out, it doesn't create opportunity for communication. And when we don't have that communication amongst the team, the patient experience suffers. And as we see in dentistry is often very elective. It's not seen the same way in the medical world. And so we need to be able to provide an experience to our patients that is memorable and that is enjoyable. Enjoyable is the best way that I can describe it, because we want our patients to come back to us. We want our patients to experience a wonderful flow from that first patient phone call through the final statement that gets sent, through that final appointment. And I've just found that silos make it very, very difficult to do that, to be able to provide that wonderful experience for the patient.
yeah, it's interesting you mentioned that so early in our conversation here, because back in 2010, I traveled to Ohio and Cleveland a number of times to learn customer service systems that big business were using and apply them back to my dental practice, because I knew I was trying to do great customer service. Because as I say quite often, nobody wakes up on a Monday morning and thinks, I've got $500 left over from the weekend. I'm going to run down to the dentist and see what they've got on special. Nobody's
Nobody.
It's not they'd rather do anything than go to the dentist. So we really do need to differentiate the dental practice to make it an experience, a pleasant experience, a pleasurable experience. And the dentistry is just, the doing of the physical dentistry is just a small part of that. And so when we put that together in our office, we found exactly what you were talking about, that even dental assistants working in different treatment rooms didn't understand what the other one was doing. And so we brainstormed everything and we came up with this great list of things, because really, if you haven't got a customer or a patient, then it doesn't matter how good your tray setups are, how good your sterilization processes are, how good your clerical systems are, you're serving nobody. So you've got to serve your customer and look at things from their eyes. So what do you do when you go to an office and you find that they're working in silos? Because it's almost you have to deconstruct somebody else's supposed good work or good idea. Let's make this a department. And then, as you said, it's at the expense of everything else in the practice, people working and not really knowing, the left hand not knowing what the right hand's doing.
Right. Yeah. When we get into an office and we start looking at the systems that are in place, because that's really the crux of all of this, right? Is the systems and the SOPs that tell you what to do, why to do it, and how to do it. And so we take a look at those systems and evaluate where do team members play a role. And there's always going to be, silos are going to exist to an extent, right? Because I'm not, as an administrative person, I'm not going to suddenly pick up a drill and know how to do a root canal. That's not going to happen. Similarly, I don't expect a doctor who is trained to do dentistry to suddenly know how to appeal a crown denial, and to write an appeal or file a claim or an insurance claim. So we're going to have these sections where people are responsible for very specific things. But I think that when I'm talking about the silos, I'm talking about people living inside so much that, like you said, the left hand doesn't know what the right hand is doing. And when it comes to when we evaluate, we look at all kind of areas, not just, the clinical side, but the administrative side too. So what we're going to do is we're going to look and say, okay, what systems do you have in place for, let's just say, answering the phone, right? We were talking about this before we started. What systems do you have in place for answering the phone? And is each person on the team aware of how that is supposed to look? Because that sets the stage for everything else. And if everybody doesn't understand how that system and how that process is supposed to work, then there's a breakdown when the patient does arrive. And there's a breakdown in, I always love to, here's my perfect example. I cheekily say I love it because I absolutely don't love it. But when I call a provider's office to make an appointment, and I might be ill, and I might say, "Hi, I'm calling in. I need to make an appointment. I have the sniffles. I have a sore throat. I have this. I have that." And obviously, not dentistry related here, for an example, but. And they say, "Okay, well, that is terrible. Let's get you in for an appointment." So they schedule the appointment, and I go into my appointment and I get there. And the first thing that the assistant typically says is, "Why are you here?" And I think to myself, well, I told the person on the phone why I was coming in. And she said, so I say, "Well, I have the sniffles. I have a sore throat. I have a fever, all the things." "Okay, no problem. The doctor will be in momentarily." And then the doctor comes in, and what does the doctor ask me? Why are you here today? And I sit there and I think to myself, does nobody talk around here? Are you not talking to each other? Or is the front not communicating? Is the not putting in notes properly to communicate why I'm coming in for my appointment? And then similarly, if it's an assistant, are you not talking to the doctor to let them know why I'm here? And we see that oftentimes in the dental field too. The patient will call in, "I'm having pain on my upper right tooth. It started 3 to 4 days ago. I'm having throbbing pain." And then all of a sudden the patient comes in, "Oh, why are you here?" And they repeat themselves over and over again. And I have found that and this is from just years of being in the field and people smarter than me teaching me how to do this, quite honestly, that there's continuity in the in the experience. And if we can learn how to communicate and do our patient handoffs the right way and talk to, and and communicate within our team, we can show the patient such an amazing opportunity and such an amazing experience that they look forward to coming back, and that they want to come back, and that they want to tell their friends to come to you. Because like you said, nobody wakes up on a Monday morning and says, you know what sounds fun today, Dr. Moffet? Let's go to the dentist. Let's head into the dental office and have a filling done. That's not the reality of the world that we live in. And like I said in the beginning, dentistry is very elective. In the US, dental insurance makes it a fun game to play for patients to get their dental work done. And if you don't have dental insurance, it can be very, very pricey. And so it can sometimes feel like you're trying to sell treatment. And I put quotations around that because I firmly believe that nobody should ever have to sell treatment. If we're educating our patients, if we're taking the time to talk to our patients and share what's happening and what we're seeing, you never have to sell treatment in your life. The patient sees the need, they see the value, and they want to move forward. So I got off a little topic there on the silo section, but I think that's really the crux of it, is that the silos really hinder that entire patient experience. And so when we're working with our offices and we're working with clients, our goal is trying to get everybody on the same page, trying to show them administratively, the clinical team needs to understand this administratively. And similarly, the administrative team needs to understand clinical. There has to be some type of shared language there, because if there's not, there's a disconnect. And if there's a disconnect, the patients pick up on that.
It's amazing. You've covered a lot of great information here, without still getting back to, and we'll get to it, the fact, the title of the article that you wrote back in May, Revenue Leakage in Dental Practices, Why Silos Cost More Than You Think. And that's the truth. It's the cost. It's the lost future cost more than anything, because you touched on it there very simply, that if we don't create an experience, we will only be judged on how bad the experience is. And they say, well, why should I pay more at this office? Because I can go somewhere else and be treated just as badly for less cost.
Right.
What you said is, again, and that description of somebody coming into an office, making an appointment, coming in, getting a disconnect from what they said on the phone to what the dental assistant says to what the dentist says, and then saying, I'm not coming back. These people don't even listen. They ask questions. They don't even listen. They're not talking to each other. And of course, what does the office say? She was probably a shopper, that patient. And so they just put everybody who doesn't make an appointment, they're probably a shopper, because unless you're the cheapest, then you are more expensive than someone. So we started that really, and sometimes you don't realize how good you are or how good your processes are until you see somebody else. So after I left my practice, which I was in for 28 years, and I left it because I'd sold it, but then it was on-sold to a second owner, and I didn't get on with them. So I started working at an office near my home. And I remember one day they booked a male patient in for an appointment in the middle of the day. And I said, okay, tell me about this patient. They go, yeah, he's got a 12 o'clock appointment. I said, all right, so how did he make the appointment? They said, he walked in and made the appointment. I said, okay, so he's a male of working age. Why is he coming in the middle of the day? Is he on vacation? Does he work shift work? What does he do? They said, well, that's not for me to ask. That's for you to ask. And I'm going, but I've got to do the dentistry. I'm not doing the questions beforehand. So all of a sudden, that's just been palmed to me. I'm getting a total stranger in my room. The second thing that you mentioned there was that often a dental assistant will bring the patient in before the dentist comes in, talk to the patient. And so in our office, we did find out the information. Then when the dentist comes in, the dental assistant then tells the dentist what they've heard. This does two things. One, primarily what it does is it shows the patient that this person knows their stuff, because one, they understand what I said, and two, they're relaying exactly what I said to the doctor. And that also means that when they have a question, they don't wait for the doctor to answer the question. They will ask the dental assistant at another time. And we make the dental assistant as knowledgeable as we can to again, dentists shouldn't be talking to people on the phone. They shouldn't really be doing too much explaining. Everybody can talk. Everybody in a dental practice is allowed to talk. They can't treat, and they probably can't diagnose completely. But as you would know, Allyssa, when a woman goes to have an ultrasound, the radiographer knows the image that she has to get for the radiologist. And so she knows back in those days, back in my days, where people didn't want to know the gender. Now that's all they do want to know is the gender. But she knows the gender. So she knows what she's looking at. It's the same in dentistry. A lot of people know what's going on, yet they don't have a degree. But you want them to be as knowledgeable, because that then makes the patient feel that they're in the right place and they're going to come back. Whereas if they feel like nobody seems to know what they're doing, then they will say, these people are so disjointed, I don't know whether they're going to get it right. Are they going to operate on my left knee or my right knee? Sort of.
Right.
So it's great. So let's move on to that cost, because it's not just at the first appointment. It's at the treatment appointment. It's as you said, at the handoffs. And this is a northern hemisphere, southern hemisphere language, I think, because we call them handovers, you call them handoffs. And so I always know when new coaches and presenters turn up where they've stolen their material from. If they use, I say, you've gotten that from me because you're using handover. And you got it from American because you're using handoff. Anyway, so, but if we don't get those sequenced correctly so that the patient understands, then the less the patient understands, the more confused they are, the less likely they are to go ahead. And again, that's a cost it's a cost to the practice. It's a cost to the patient, because the patient should have had the treatment done. We only diagnose treatment that needs to be done. We shouldn't have to sell it. They should say, oh, I'm glad that you've told me that. I'm going to get it done. And so when there's confusion, they don't get it done. Because it doesn't hurt, they delay. That causes them more expensive, more invasive treatment because they've delayed. So we've got to be as clear as possible, and we've got to be seen to be a unified team, not just all wearing the same uniform. So
talking the same language with each other.
Yeah. And sorry, I'm starting to take over. And it comes back to even at the hand off, hand over. I worked out that the dentist should be standing on the same side with the patient, not on the other side with the receptionist, because it's a 2-on-1 situation. It's a hand off, hand over, where the dentist say, here's my patient, I want you to take good care of them, as opposed to, we're going to put you in an appointment, and if you don't understand, that's your fault for being confused. It's all about where we stand and getting those things correct. So the cost is more than the lost treatment. The cost is then the investment in getting another patient. It costs 9 times more to replace a patient with a new patient than it does to keep an existing patient.
Yeah, absolutely. It's funny because you had said that the difference between a handoff and a handover. The one of the best words that I've seen to describe them is called a trust transfer, because and this was something that a consultant taught me when I was just working as an office manager, and the message was, you're transferring the trust of your patient from team member to team member, because that's really what it comes down to. Is if your patients don't trust you, if your patients don't trust what you're telling them, about their treatment, about their finances, if they can't believe what you're saying and fully put, there's no other word, they put their trust in you, and that trust breaks down, we start to see revenue leakage. That's where we see revenue leakage. That's where we see the cost of these things, because like you said, the patient's not going to return. The patient's not going to tell their friends to come, or family members, or anybody. In fact, you might end up getting a poor review for it, because the internet is everywhere and all the things at once. And so it really, one poor experience can what's the word? Snowball into a much bigger problem. And it usually doesn't silos at a glance just look like everybody doing their job. The front desk answers the phone and schedules the patient. The assistants treat the patient. They take the x-rays. They assist the doctor. The hygienist helps diagnose treatment, and they do prophies and scaling and root planing. But at the crux of it, the breakdown in the patient that patient experience and that trust, those trust transfers is really what ends up costing the office money in the end.
It's you've summed that up beautifully, because everybody in the office knows what has to happen, but if the patient doesn't see and hear the message repeated along the way, they won't trust. The receptionist knows what to tell the patient. If you don't get this crown done, that tooth could break. But if the doctor hasn't said it in the treatment room, they're going to say, how would you know? You weren't in the treatment room. So we've got to, sometimes we have to go back to teaching small children or teaching our own children and repeat things slowly over and over so that they hear it 3 or 4 times. Because often if they hear it at the wrong place, they will ignore it. They will resist it. And if it's rushed again or presumed, it's a death sentence for that relationship. The patient will go elsewhere, and of course, don't get me started. The patients that go elsewhere that say, "I've just been to a dentist. They say I need this, this, and this. What do you think?" Well, the first thing that next dentist does is tone it down and say, "Oh, you don't need that. You only need this.
Need those things."
And I'll pick them up in a year's time. I'll just say, yeah. Anyway, the important thing is that everybody's got to sing from the same hymn book. I remember once one of my wife, who was working at the reception, said, the patient said to me, they leaned in, they said, "Do I really need this done?" And she answered, she said, "If you don't get this done, this, and this will happen." And the patient goes, "That's exactly what he said."
And it reiterated and it built that value for the patient, because you went and the patient instantly probably got frustrated, like, "Oh, nuts." Like, I was hoping someone would be like, "Oh no, you really don't need it." But that message is so important, because if you're not giving the patient the same message, if I like when hygienists and assistants pre-warm the patient. When you've worked with your doctor for a little while, you kind of know that by looking at an x-ray, hey, listen, it looks like, when we see an x-ray that looks like this or a tooth that looks like this, generally the next step is a crown. So then when the doctor walks in and says, it looks like it's going to be a crown, it's not that much of a bewildering experience or a moment where the patient's going, "Oh my goodness, I had no idea," because the hygienist already warmed up the patient for that news already. And so I love that. I love when the doctor and the assistant and the front, that they're able to, and it takes the team working together. This doesn't happen by osmosis, and a lot of people think it does. Like, well, how do you get your team to do this? You have to talk. You have to do trainings. You have to be one together, and everybody's got to have the same skin in the game. They have to have that same passion for helping the patient, because all it takes is a team member or two that says, "You know what, my job's just to answer phones." That's not the dental world. If that's not the world that we live in anymore. And I mean, that's not not in private dentistry. That's not the way that you can run your business. If your front desk team member thinks, "I just answer phones and schedule patients," that they're number one in the revenue cycle. I mean, number one. And if they're sitting there saying, "Well, revenue doesn't have anything to do with me because I don't collect money or I don't do treatment," they are sorely mistaken, because it all really truly starts right there.
That's you've just described 2 or 3 silos in the one person.
Exactly.
And that can also be brutally fatal for a dental office. My role in answering the phone is to, I hate using this, but I have to sometimes when talking to people. Are you just a slot filler? Because basically you're just, there's a slot, I'm going to put a name in it, now my job's done. I've put a name there, now my job's done. And not with any respect as to how the day flows, whether that's the appropriate time. My next available slot is not listening to what the patient needs. My wife says, she said this for a long time, she says, they haven't called the dental office because they want a pizza. They want they have a dental problem and they want that problem solved. And usually the solution to the problem is an appointment. They're not rung up for a pizza.
Correct.
So why is that phone ringing? Because they have a problem. Let me find out what that problem is. let me give them a solution, which is 9.5 times out of 10, it's an appointment. And because that appointment then has to be scheduled at a time. And if I don't have an appointment, if I don't have an appointment when they want, I've got to give them our next available. And then I've got to give them some hope, which is, you know what, Allyssa, if I get a change in my schedule between now and when I've got you booked, I'm going to call you and bring that appointment forward. What have I done? I've just given you, Allyssa, I've told you that you're going to get you're going to get that first availability. I didn't say I'm going to put you on a list.
Right.
Because nobody walks around, I'm 20th on Dr. Moffat's list.
Right.
Well, that's like being 20th in line for the throne. There's only 2 or 3 people really going to become kings of England after Charles. It's true. So don't give them a title that they don't, that is worthless to them or is actually almost an insult to them. But you tell them, I'm going to be calling you. And so there's so much around. The other thing, and here's a silo that I'll leave it for you, laboratory work. Now, in the old days, you used to have to send it and get it back. Now you just have to get it back because sending is done digitally. But still, even when it's done digitally, sometimes somebody's forgotten to hit the send button on the computer. And of course, people go, where is this job? Why is the patient here? Where's the job? And of course, having a set system where people know, in the appointment book and saying, all right, so-and-so's coming in tomorrow or the next day, is their job back? Why hasn't it been marked? We're finding it rather than waiting till they turn up. And then again, that's a really poor experience as well.
Absolutely.
So
I've seen that plenty of times. I mean, if anything, if I'm terrible, if my greatest flaw in life is probably that I'm too transparent. So I'll be transparent in this next story. One of the first offices that I ever worked in did not have a lab system. And there were so many times in that very beginning stage when I worked there that we would have patients that would show up and we wouldn't have their crown back or we wouldn't have their bridge back. And we'd have to sit there and go, oh my gosh, we're so sorry. The lab, and the lab didn't do it. No. Like we dropped the ball. And so we very quickly had to evaluate that system to say, who's responsible for this? Who's responsible for checking for these labs? Who's is it the front desk administrative team? Is it the clinical team? And then we had to write the system and we had to have something in place that kept everybody on the same page. And it included steps that said things like, if the lab case isn't back within 2 days, this person or this role is responsible for calling the lab to find out where it is. And then if it's not going to be back in time, this person is responsible for calling the patient. Because if you don't have those simple to-dos and how-tos, it's a free-for-all. And and what I like to say is if everybody's responsible for it, nobody's responsible for it because there's no accountability there whatsoever. And but similarly, like, for us at that point, it was very clear the silos. I look back at it now, hindsight's 2020, right? And it's very clear when you look back at that to say we were just living in, I was administrative, they were clinical, and our roles didn't touch. We didn't overlap. And now being in the field as long as and not that I'm by any means been doing this for 30 years, like the wonderful people that I know and look up to, but looking at what I've learned now, this is so just unbelievably critical. And I used to come at it, this is a little off topic, but I used to come at it to, okay, it's not your responsibility. You may not have to understand all of it. But the more that I watch teams and the more that I interact with teams on a regular basis, it's so very clear to me now that the administrative team and the clinical team have to work as one. And it's very, very easy for them to kind of create some animosity towards each other because they're very different roles. I see a lot of dental reels on Facebook and Instagram of, the front desk is just sitting at the front, drinking their drinks, drinking their coffees, clicking on their things. And that's how the clinical team sees the front desk. But then the front desk sees the clinical team walking around without patients and coming up 5 minutes, 10 minutes late to get their patient when they've just been stand and talk. And it's like, and we see these things, and that's okay. That's okay that these things happen. But at the end of the day, if your team isn't communicating with each other, it can create a divide between them. And that's not okay, because again, it all comes back to that patient experience. If you're not communicating with your team, you're not all on the same page, that patient experience is truly going to suffer.
It's so true. And this is something that I learned back in Cleveland in 2010, that we've got to look at everything from the patient's point of view, from the moment that they decide that they're going to call the office, as you said, to the moment that they finish their treatment and then their course of treatment. And so they have this process. So it's not so much the patient wants to understand that the setups are done okay, but what the patient will understand is, if I'm having a crown, why are they running and getting stuff now that I'm already in the chair?
Oh, yes.
Didn't they know that I'm? And I used the crown because it's an expensive procedure. I even had the situation I did own 2 locations nearby to each other, and we had a situation where the patient I was treating, they had to call the other office and say, we need some putty because we've run out of putty for the impression. And I'm going, how did we get that low, and how did that happen?
Oh no.
Fortunately, it wasn't an absolute disaster, but it's about, as you said, handing over the information so that the patient has a seamless visit. Because if the more seamless the visit is, the better the experience. If they have more time to chat at the start and the end, because the dentistry is done so efficiently, they don't mind. No patient ever says, that extraction only took 30 minutes. I was expecting 60. Can I go back in and you dig around for another 30 minutes? That no patient ever says, take a longer, doc.
Right.
Yeah. I've paid for 60 minutes. Take 60 minutes. Yeah. And they never say, if you say you can do it, if you do it quicker, they never say, well, that was quick. Can I have a discount? Because it's all about the time and the trauma as well. A quick operation, a small amount of drilling is less traumatic. But it's as you said, it's that information flowing from one person to another, and knowing what to collect, knowing what information to collect, and knowing to be able to pass that on so that the patient feels like they're being treated. 1, they're not being ignored. 2, they're not being taken for granted. And 3, they're being treated as more than just a tooth with a credit card. Because
Absolutely.
That's often, if it's too clinical, too administrative, they go, where's the personality in it?
Right.
Where's the concern? And so we've got to always remember that there's a real live human being on the end of that procedure that we have to nurture through and hand through. I learnt it, Allyssa, in the 90s when I had laser eye surgery. I went to an ophthalmic surgeon. I was there for 2 hours before I met the surgeon who was going to perform laser eye surgery. I was there being treated and handed through from one optician to somebody else measuring. And by the time I met him, I had no doubt that this was going to be the place where I needed to get my eye surgery done, because they worked as a team. And it reminded me, there's a movie that this is in, and you're going, what movie is about an ophthalmic surgeon doing laser eye surgery? But it's a movie that's been around since the 1930s, and it's the same message, and that is The Wizard of Oz. Because by the time Dorothy meets the wizard, she is in no doubt that he is the person who's going to get her back to Kansas. Despite the detours, she says, I've just got to get to meet the wizard. It's the only way. And even though he's just some little old man behind the curtain, she knows that that's the only way. And so the journey along the way has to be building credibility and making it as an experience. And so when that happens, the result is that she has total belief that she's in the right place. And so that's what I had with the ophthalmic surgeon. And that's then what I wanted my patients to understand, that by the time they met me, everybody had shown that you're in the right place.
You're the right guy for the job. Right.
This is your new dental home.
Right.
And so that's what we've got to do. It's got to, and it's, it's more than, how many offices do you go to where team members walk in through the front door and don't notice that there's maybe some leaf litter outside the building, or there's some trash outside the building, or there's dirty marks on the glass door, and it's because they're focused on the job they've got to do inside, and not saying, hey, my next patient could see that and think, oh, their windows are dirty. Are their instruments dirty?
Ooh,
And they go,
that's true.
yeah, not my job. But don't you hate that? Not my pay scale, not my job. That's like, it's everybody's job to make sure that everything works and everything flows.
I like to do a little experiment and exercise where we have team members will actually sit in the chair or walk through the office as they're a patient and look at things. Everybody, we're in the office all day. We see the same things all day. But when you sit in the patient chair and you recline back, it's a totally different view than what our clinicians are used to seeing. And so sometimes when you recline back, you see things from a different perspective that don't necessarily get seen unless you're the patient. And so we like to do this exercise with team members where we'll say, okay, go to your clinical room, get in your chair, recline back and look around. What do you see? What looks out of place to you? What seems dirty to you? There was one office that had a paper towel dispenser. And when the paper towel, when you were standing, it looked fine. But when you reclined back, you could see underneath and it was all chipped and the paint was all chipped and it looked real nasty and dirty. And all of a sudden we went, oh my gosh, what does that say about our office? Like, what does that say about if that's what the patient sees? Like, how kind of scummy did it look? And so we do this exercise as a way to say, what are we looking at? What are we seeing? What are our patients seeing? So that way, what they are seeing is a direct reflection of us. And we want it to be a good reflection. And like you said, and if your paper towel dispenser is a little dirty, what does that say about your other cleanliness activities? And it's true. I mean, I don't know how things are in other parts of the world, but I know that in the US right now, in medicine especially, patients are often treated just like a number. And I like to say that the bar has been set so unbelievably low, that customer experience, that customer care that we can give our patients goes a very, very long way these days, a very long way. And I love your analogy of the wizard, because what a wonderful, wonderful image of you've been along this journey the whole time and you meet the doctor now and you realize that you are where you're supposed to be, because everybody has built the value along the way. Everybody has warmed up the patient to let them know that this doctor that you're about to meet is going to take such unbelievably good care of you that you're never going to want to look for another dentist ever again, because we're just going to be it for you. Like, how wonderful would that be if that was every patient experience? It would be none of us would have jobs, right?
Well, often dental offices build it backwards. Like, I'm the doctor, here's all my degrees, here's all my fancy equipment. Now I'm going to talk at you for half an hour because I want to get to know you. But next time you come in, I'm not going to talk at you because I'm going to be doing dentistry. And it's kind of like, well, what was that first thing about? It's like the opportunity meeting. It's fantasy. So let's just make the doctor approachable, but friendly, but in the right place. But let's make everybody else even more agreeable. I love going there because everybody treats me so well.
Yes.
From the moment I walk in the door, they know who I am. They know how I look. I take my coffee. They know what I've been up to since I was last in, all that sort of stuff. And when I leave, they talk about what have I got planned for the rest of the day? What have I got planned for the next week? And they bring that up the next time. And that's what people want. They just want to be made to feel, important. Mary
It's
Kay
true.
Ash said it best, didn't she? She said everybody's walking around with an invisible sign around their neck that says, make me feel important. And we've
It's
just
true.
got to remember that. That's
It's
all they
true.
want to talk about. They want to talk about themselves, and we must focus on talking about them.
Yep. That authenticity. People crave authenticity. And in a world full of technology and disconnect, my previous training prior to getting into dentistry, I have a degree in ministry and biblical studies. And what a unique world I've lived in. To bring those pieces. And one of the big things was always about authentic relationship. That's what we crave as humans. And if we can bring that authenticity into the dental space, into that customer service experience, we can transform the dental world. We really can. But it takes a community effort to do so. Because if we don't, we can see the repercussions of what it'll do to the dental world. Yeah.
I think, and I remember you mentioned the ministry work when we spoke last month. It's interesting because you can buy a Bible, the red letter Bible, where Jesus' words are in red. And if you read his words only, if you just go through and read his words, he predominantly talks about you and not about himself.
So true.
And
So
that's
true.
all people want to know. They just want to know, that you care about them. And so even if we get back to the phone greeting, my wife teaches it so well, and it gets abbreviated. She says, you've got to identify your office, you've got to identify who you are, and then you've got to ask this question: how may I help you? How may I help you? And people say, how may I help? And of course, that then puts it onto the help and not about you.
Them, correct.
Yeah. So it's focus. It's just for how may I help you, because that's their most important subject is themselves, and they want to know you care. They're fearful. You've worked in offices enough to know that it doesn't matter what the person looks like. Sometimes the frailest little old lady has her dentistry done without an injection, and yet the biggest muscle man guy is terrified of dentists and breaks out in a sweat. And
It's
each
true.
of those need to be treated so well. You did mention in your article about some silos, and you were talking about one which is very US based, as we were talking before: insurance verification versus reality. The front desk quotes one thing, the clinical team delivers another, the patient's confused. That's a real silo. And I think whether we're working in the fee-for-service area of dentistry, which I know there's some in the US, there's a lot more percentage in Australia. The issue I found was that patients really only want to know a ballpark figure as to how much it's going to cost them at the start, and then all they really know is, what am I doing next time?
Right.
What am I coming for? What's wrong? What are you going to do? And what will happen if I don't get it done? And of course, no financial surprises. And if you can just chunk it down into that clarity, all right, and that's the description of a handover. This is what I did today. This is what you're going to feel. This is what I'm going to do. This is where I'm going to work next time. This is what's wrong with it. And this is how long I'm going to need. And this is what's going to happen if you don't do it in the time frame that I said. And that's all they want to know, because how many times do we hear it on the phone, and we still hear it? When's my appointment? How long is it? And what am I having done? How did you get
on the appointment books? I don't understand. How did you get an appointment?
What? Who has let them down along the
Right.
way? And was it you who was telling me there's some offices where the dentist is known as the flipper? He just comes out and just flips the chart and then runs away. He just flips the chart and says, I need an appointment, and flips it. There's not even a verbal handover. Yep. So it's, again, all about communication. And you said that it's that trust. If they don't hear it from the dentist, if they don't understand it while they're in the treatment room, having somebody non-clinical then going over it, even if that person is very credible, because they weren't in the treatment room at the time, it's got to have been heard, and it's got to be heard again. And so, I like it when the dental assistant takes the patient out and repeats what the dentist has said in the treatment room, and then the receptionist then takes that as well. And of course, that's all choreography, Alyssa, because when the dental assistant brings a patient out, the dental receptionist needs to be ready to receive that, not start another conversation. Hey, did you see Love Island last night? Or, like, let's get the treatment organized, and then let's do
Absolutely.
the social stuff at the end. It's all about that trust and working together. As a way of concluding this great discussion, I think the teams that work well together, also the offices organise events outside of the office for those teams, dinners, social events, so that there is a unity,
Mm-hmm.
because it comes down to ultimately that the office has a culture and a
Yes.
mission statement and has values, and we've got to have everybody on the same page in those three things. If the culture doesn't match, if people think they're just doing a duty and it's a silo, it will ultimately break down the purpose of what we're trying to achieve in our business. So, are you finding that great teams, great offices have great teams that respect each other and know
Yes.
each other outside of what the roles they do?
Absolutely. I think that when there's camaraderie amongst your team and you have teams that don't just look at each other as coworkers, but as friends that are working towards the same goal. And that's honestly, I think, one of the areas where I see most is that a lot of offices don't necessarily have a written mission statement or a vision or value statements that are written. And so what goal are we all working towards then? And so it needs to be detailed out. And if you don't have, and anybody listening in, if my biggest encouragement, I take it from somebody who with working my own business, I just wrote my own mission statement in the past several months. When you have your mission statement, it puts everything into perspective for you. And so if your team isn't aware of your mission statement or you don't have one, get one soon. And then get your team on board with it. Because once your team is on board and you are all working towards that same goal, it changes the entire landscape of how your practice works and how your team sees themselves and how they see their role of importance in that patient experience. Because like I said, if you're, I can't wrap my head around I'm just a receptionist, I'm just a dental assistant, I'm just a hygienist. You are a core piece to a health care system and an experience where it's either going to make it or break it for the patient. And if we can't recognize that, if your team can't recognize that, you need to calibrate with your team and get everybody on that same page, because it's just so important that everybody is working towards that same goal.
I just recently clarified it for a client of mine and her team, and I just said, we're working in the customer service business and the health industry, and then the subset of dentistry from that,
Yes.
and not the other way around, or not just dentistry. And because everything that we do, we have to do it with the best service, but primarily we're about improving not just the mouth, but the overall health of our patients. The best news I've heard in dentistry in the last 10 years is that dentistry is finally waking up to the periodontal disease and diabetes. It's a continuing loop. If you've got periodontal disease, that affects your diabetes. And if you've got diabetes, that affects your periodontal disease. So we've got to have clean teeth. And so when I see an office where they're doing 6-month cleans only, I'm going, where's the 50% of patients who have got a periodontal disease, just by age more than anything even. So it's health, and everybody's got to sing from that hymn book. Back to the receptionist, I need to book in for a checkup and clean. We've got to find out how long since they last had a clean, because if it's been more than 12 months, there's a chance that we're going to need an extra visit. And if we don't frame that up, you mean I've got to come back and I've got to pay for it? We've got to frame it up. The reason you have to come back and the reason you have to pay for it is because you haven't come in
Yes.
as frequently as it should. And all of a sudden, we're backpedaling there again right from the start because we're working in a silo. My job's just to make them a time. They wanted a clean, they're booked in for a clean. How long since they had a clean? And then if it's not framed up, it can create that snowball.
It does.
That serious
It very much
snowball
does.
of
Yes.
neglect. And then, I was able to, you haven't been in for 15 years. I was able to do the clean in one visit. That patient really needed better attention, better awareness. And if we haven't given it to them, another 15 years.
Absolutely.
And then those
Absolutely.
teeth will be waving in the breeze. It's sad. It's been good fun talking to you about the silos. I've really enjoyed this, and it's nice when I come across somebody writing something and saying something that is so simple and so obvious, but yet so meaningful. And I think, as I told you before we started recording, and when we first met a month ago after I'd read the article, I thought it was so important. I printed off copies for a face-to-face day training with one of my clients because I could see that they were starting to work in silos and they need to integrate with each other. And it's a patient journey, and everybody's got to be on the same page, which is the patient's health, customer service.
Yeah.
And if we do that, we have really, really successful patient practices. Because if we don't do it, Allyssa, what's the consequence? Too many cancellations, too many blank spaces. And then they're trying to fix a problem which needs to be fixed back here in
Right.
terms of customer service and culture. We fix that, we don't have the cancellations. Then if we get a couple of changes, we've got people ready to move forward. It's all about just setting our values and our mission for our patients. And
true.
silos, as soon as we start hearing silos or about silos, we should be like, we've got to fix this
Run.
before they form. Yep. Get it organized before they form. Allyssa, thanks so much for your time today. If somebody's watching this or listening to this podcast, what's the best way for them to get in touch with you?
Great question. So you can reach out to me by email. And my email is Allyssa. Allyssa is spelled a little funny, so I will spell it for you. It is Allyssa. A shout out to mom and dad for that one. So it's my first name, Allyssa, at Zen dentalsupport.com. You can also find us on Facebook and Instagram at Zen Dental Support. And that is the best way to reach me. So if anybody wants to talk more about silos, please reach out because I am happy to discuss. It is something that I'm very passionate about, and I'm passionate about the dental field in general. I love dentistry. I never thought I'd be here, but here I am doing working in this field, and I just love it to pieces. But thank you so much for having me, Dr. Moffet. It's been wonderful hour with you, and I just so look forward to continuing our chats because it's just a pleasure chatting with you.
Well, I'm sure the way you write, I'm sure I'm going to be reaching out when I read future articles of yours and see posts. And I also found, I also double checked you on LinkedIn as well. So that's where some of your posts, but I think your article appeared in the one that I read was in Dr. Bicuspid. So you're out there and other people are already noticing what you're writing. So keep up the good work because
Thank you.
Dentistry, as we've mentioned just then, there's so much dentistry that's not being done that still needs to be done. And the best way for dental officers to get it done is to get the advice so that they do things efficiently. And the best way of doing things efficiently is to have somebody there keeping you accountable for those efficiencies. And that's a dental practice advisor or a dental practice coach as well. So keep doing what you're doing. Allyssa, thanks so much for your time today. It's been a pleasure.
Thank you so much. Take care.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.